Another dream is within reach. A student opens up a book. An entrepreneur takes another look.
Health is one of the most essential parts of community life. Prevention, care, treatment, and access to medical support when it is needed most. Healthcare access is about ensuring no one is left behind when they need help. Tonight, our panel asks, how can communities strengthen healthcare access? Welcome to the Thunderdome. Good evening and welcome back to America Together Radio. Last episode, we explored housing access. Tonight, we focus on healthcare access clinics, prevention, affordability, emergency care, and building healthier communities.
So healthcare is about access, not just treatment.
Exactly. A strong community ensures people can get care before problems become emergencies. Tonight we'll discuss clinics and local care, preventive health, emergency services, affordability and insurance access, public health education, and ways communities can improve healthcare systems together. President Pipeline, when a community wants to strengthen healthcare access, where should it begin? We'll hear your answer right after the break.
Seasons come and go through moments filled with hopes and fears. The lakes lie quiet in the dawn, reflecting.
Welcome back. Tonight's question, how can communities strengthen healthcare access? President Pipeline will begin with you.
Thank you. Healthcare access begins with availability. Do people have clinics nearby? Can they get appointments in time? Are services easy to understand and use? Communities must identify gaps before they can fix them.
So awareness of gaps is the first step.
Exactly. You cannot improve access without knowing where access is missing.
Sometimes people delay care simply because they don't know where to go.
Information is part of healthcare access.
Liberty Jack, your perspective.
Expand local clinics and urgent care options. Support mobile health services for underserved areas. Improve transportation to medical facilities. Healthcare must be reachable to be effective.
So location matters.
Absolutely. Care must be close enough to access when needed.
Understanding gaps is essential.
Expanding access is the solution.
And both save lives over time.
A strong beginning for tonight's discussion. After the break, Lady Progress discusses prevention, education, and public health systems. Captain Constitution explores responsibility, fairness, and healthcare equity. Stay with us.
Where the maps start breaking down, a river winding through the pines, and a million acres.
Welcome back. Tonight we're exploring how communities can strengthen healthcare access. So far we've discussed availability and expansion of care. Now let's continue. Lady Progress, how do prevention and education improve healthcare access?
Prevention reduces the need for emergency care. Education helps people understand how to stay healthy. When communities invest in both, overall health improves and systems are less strained.
So prevention helps everyone?
Exactly. Healthy communities start before illness begins.
Captain Constitution, what role does fairness and equity play?
Healthcare access must be fair. People should not be excluded because of income, location, or circumstance. Equity ensures that care is available to everyone who needs it.
So fairness is essential to the system?
Very much so. Without fairness, access becomes unequal.
President Pipeline, what stands out to you?
Access begins with awareness.
Access requires availability.
Prevention improves outcomes.
Equity ensures fairness.
Sometimes the best healthcare is the care you never have to delay.
Prevention changes everything. Market Maverick off microphone, and so does actually scheduling your checkups. After the break, Market Maverick discusses practical healthcare systems. Professor Data explores research on public health outcomes, and the People's Advocate shares everyday habits that improve community health. Stay with us.
I'm Jeremy Levan. Rural communities understand problems that national politics often ignores. Distance, roads, hospitals, water, agriculture, energy, broadband, schools, and local services are not abstract issues. They are daily realities. America Together 2028 wants those voices included.
The tires roll across the open.
Welcome back. Tonight we've discussed availability, prevention, and equity in healthcare access. Now let's ask an important question. How can communities turn healthcare ideas into real-world systems? Market Maverick, what practical steps improve healthcare access?
Expand clinic hours to match working families' schedules. Improve appointment systems to reduce wait times. Increase telehealth availability. Make healthcare information easier to understand.
So systems design matters.
Exactly. When systems are simple, people use them more effectively.
Professor Data, what does research suggest about healthcare systems?
Research often associates strong healthcare systems with improved life expectancy, reduced emergency visits, better chronic disease management, and higher community well-being. Communities benefit when healthcare is accessible, consistent, and preventive.
So access improves outcomes.
Very much so. Early access reduces long-term strain on systems.
People's Advocate, what practical advice would you offer listeners?
Schedule regular checkups. Learn about local clinics and services. Share health resources with others. Take small steps to stay informed and healthy.
Quick thoughts.
Awareness guides access.
Availability saves lives.
Prevention improves outcomes.
Equity ensures fairness.
Environmental health also affects human health outcomes.
After the break, each mascot shares one habit that helps communities strengthen healthcare access. Then we'll conclude tonight's discussion and preview our next episode. Stay with us.
The morning sun still fans the mountains.
Welcome back. Tonight we've explored how communities can strengthen healthcare access. We've talked about availability, prevention, equity, systems, and practical care delivery. Now let's close with one final question. If you could encourage every community to practice one habit that strengthens healthcare access, what would it be?
Stay informed about available healthcare resources. Awareness helps people get care sooner.
Make healthcare easier to reach for everyone. Access should never be a barrier.
Focus on prevention and education. Healthy habits reduce long-term strain on systems.
Ensure fairness and equal access for all people. Equity strengthens trust in healthcare systems.
Protect environmental conditions that influence public health. Clean air and water are essential to well-being.
Simplify healthcare systems so people can actually use them. Clarity improves outcomes.
Encourage someone else to take care of their health too. Community care spreads awareness.
Continue evaluating healthcare systems and expand access to preventive care, affordable treatment, and reliable public health infrastructure across all communities.
Healthcare is not only about treatment, it is about access, prevention, equity, and the systems that support daily well-being. When communities work together, health improves for everyone.
What's next inside the Thunderdome?
Next time, our panel explores Episode 089. How can communities strengthen public education systems? We'll discuss schools, teachers, curriculum, access, opportunity, and building stronger learning environments for all students. You've been listening to America Together Radio, simulated mascot debate Thunderdome. Today's discussion featured fictional mascot characters created to explore civic ideas through respectful conversation. The characters are fictional. Their conversations are intended to encourage health, equity, and stronger communities. Thank you for listening. Until next time, keep caring, keep learning, keep building together, and we'll see you inside the Thunderdome.
The same as they have through the years, watching seasons come